Welcome, everybody. I'm Vivek Kulkarni. I'm the education editor for JACC, and I'm very happy to be sitting down and talking to Dr. Ben Freed, who is a cardiologist at Northwestern, program director of the Cardiology Fellowship there, and relevant to this conversation, also is chair of the ACC Program Director and GME Council. And I'm happy to welcome Ben to talk about his new piece in JACC on signaling. Thanks, Ben, for doing this.
Yeah, happy to be here. Thank you.
So first, I was hoping that you could just sort of walk us through briefly what signaling is in the upcoming cardiology application season, how it works, and a brief overview.
Yeah, absolutely. So signaling is something that the AAMC started in about 2020, 2021, I think, for most residency programs. And the idea behind it is to allow applicants to basically signal their preference in terms of what programs they would like to apply to. Over the years, the idea has been that if applicants are given a certain number of quote unquote signals to tell programs that they're interested in them, that it will ultimately help the match process and get applicants to the programs that they would best fit into, and also on the other way around, have programs be able to find the applicants who would best match with their program. So the signals are different in terms of program to program, in terms of how many signals each program or each residency program up until now allows the applicants to have. It can be as little as 3 to 5 signals and as many as 25 to 30 signals.
And that's specialty dependent, right? Not dependent on an individual program.
You got it. It's specialty dependent. And what happens is like, for instance, in orthopedics, let's say, there is a body, an organization within orthopedics that says we are going to do 30 signals. And then all the programs, all the orthopedic residency programs either can opt in or opt out of the signaling process for recruitment. But if they opt in, then it's 30 signals for their program.
So what's happening with cardiology this year?
So this year, the AMC ARIS has opened it up to fellowships, and so cardiology is included in that. And that organization came to the ACC PDGME or the Program Director and Graduate Medical Education Committee about 6-7 months ago, maybe a little longer, and asked us to decide how many signals we would like for cardiology. Our decision, after some research in terms of what the residencies have done, was to allow 20 signals for applicants into cardiology fellowship programs.
And for those who may not know, maybe you could walk us through the sort of nitty-gritty of the process of actually going through signaling. The piece that you and your colleagues wrote in JACC in our learning and training feature walked through some of this, but maybe you could explain sort of what should an individual applicant do, and how should an individual applicant think about signaling as it goes to this year?
Yeah. So, fortunately, a lot of these residents who are applying for fellowships have actually used signaling because they used it when in their for their residency program recruitment. So they actually know a little bit better than the programs themselves in terms of how signaling works. But essentially, this being the first year, there's going to be some programs within cardiology that are going to opt in, and there are going to be other programs that are going to opt out. And so we are making a push with all the programs to put that information onto their website and advertise to the applicants whether or not they are participating in signals, and if they are, how they're going to use signals. Because some programs might choose to only invite people who signal their program for an interview. Some might choose to say we will do that, as well as also invite people who have not signaled our program for an interview. And some might say we're not using signals at all, so it has no bearing at all on who we select to interview. And so as much as we can be transparent to programs and getting that information out to applicants, I think we should be. And then that's where applicants should start in terms of determining from the programs they're interested in which ones are in the signaling process and which ones are not, and how they're using signals. And then, I think applicants should consider signals as a way essentially to tell programs without verbally telling them that they are interested in your particular program. So if a program receives a signal, they know that the applicant is thinking, this is a program that I would like to really learn more about because I'm strongly considering this program for whatever reason. And applicants, what has been shown in residency is that the programs that are signaled, the applicants who signal those programs are more likely to get an interview than applicants who do not signal a program. It is by no means a guarantee for an interview, and it's certainly by no means a guarantee to get into the program, but it has been shown that it is more likely that applicants will get an interview at those programs if they signal them.
So if I'm an applicant and I have 20 signals, I really should allocate those signals to the programs that I'm most strongly considering that would be my top choices to learn more about. Is that correct?
Yeah, and you might have to be a little strategic about it because, we did provide a larger number of signals, I would say, than many of the specialties and subspecialties out there. However, if you look at the data, the average number of programs that cardiology applicants are applying to is somewhere in like the 80 to 90 range.
Yeah, I've heard the same from our prospective applicants and current fellows here that it's, 90 or so. So really applicants will need to be somewhat attentive to which programs receive the signals from them.
Exactly. And so I think what a lot of residency program directors have guided their residents in doing is thinking about of the programs that they're interested in, what are the kind of reach programs, if you will, what are the programs that they might have a little bit of an easier time, but still competitive programs, and then maybe the programs that are not all that competitive or not all that challenging, and splitting them up that way to better able figure out which signals they should use or which programs.
One other question I've heard from some prospective applicants this cycle is, should I signal my home program? I don't know if there's any data on that or if you have an opinion on that.
Yeah. So it's important for residents to find out if their home program requires that. So if you're interested in applying to your own program, many programs who have opted into signaling are saying that their own residents don't need to signal. And so residents should know that ahead of time so that they don't use a signal for their own program if that's the case. There are reasons I've heard, on both sides as far as whether or not cardiology programs should do that. On the one hand, in our program, for instance, we have always traditionally interviewed every Northwestern resident who is interested in our program, regardless. That's just something that we've always done and that we plan to continue to do. So because of that, we did not feel that our residents needed to use their signals in order to interview with us. So that's one more signal that they get to go to another program. On the other side, people are saying, well, that's not really fair, because if you don't keep that consistent amongst the programs, Some residents are going to have that extra signal in their pocket, so to speak, and others will not, because they'll have to use it for their own program.
Yeah.
So I think we're going to have to figure out as we go on, how best to do this.
Well, that's good advice, though, for applicants, that they should clarify with their specific home program about what the expectations are.
Yeah.
Because I imagine, as you said, it varies from program to program.
Yes.
Now, imagine for a minute that you're advising other program directors about what to do in this application season and how to handle this new thing that none of us are used to. What advice would you give to programs about how to review applications, how to conduct interviews, how, anything that would be helpful?
Yeah. So I would say, for starters, I would give signaling a chance. I think it's always, for many programs, it's always change is hard. And it's very difficult sometimes to, do something different than what you are used to doing, because you don't know how that's going to ultimately affect recruitment. When we were forced to change 5 years ago now for COVID, and everything became virtual interviews, everyone just had to do it, but it was very, very challenging. And I think people, if given the option, would rather not have such significant changes. I don't think is as much of a change, but I would first recommend that cardiology programs give it a chance. And I think as the years go on, more and more programs will join in signaling. But in terms of then, if they are in the signaling program, so to speak, and decide to use it, there's a couple of very important parts to this. One is, as I mentioned earlier, it's important to be transparent with the applicants in terms of how you're using signaling and whether or not you're using signaling, and to broadcast that ahead of time. The other part of this is that signaling really should only be used for inviting people for the interview. It really should not be used after that. It should not be used for the rank list, partly because once an applicant interviews at a program, they might change their mind in terms of what they're interested in. I mean, that's part of why they're interviewing with you, because they also get to see whether or not they truly want to go to that program, or feel like they would fit into that program, or that it would best serve their needs. So programs should not use it really after the interview process, or and then I would say, very importantly, during the interviews, the interviewers should definitely ask the applicants why, if they signaled them, why they signaled them. They should learn, why the applicant is interested in their program. But they cannot ask the applicant, if the applicant didn't signal their program, why they didn't signal their program. And they cannot ask the applicant, or should not ask the applicant, what other programs they might have signaled. Those are no-nos, just like many other no-nos that we provide a list for people who are going to interview applicants. So that's really an important thing to keep in mind for programs as we integrate the signaling process into recruitment.
No, that's very good to know. I think many of us are already in the habit of asking applicants, what attracted you to our program, and this is maybe a more quantifiable way to ask that question.
Yeah.
Well, the other topic that you address, you and your colleagues addressed in the piece in JACC, is what are some potential issues with this system, and maybe more importantly, or related to that, how are we going to know if this is serving our needs as a field? Moving forward, how can we evaluate whether signaling is doing what we want it to do?
Yeah, exactly. I think that those are really important questions, because, like any new thing, we don't have a lot of information at this time. I think, to the credit of AAMC, they have been gathering very good data since they started this program 4 or 5 years ago with the residency programs. And it did allow us, cardiology, to help us figure out and decide whether or not we wanted to do signaling, and if so, how many signals we were going to use. And I think that is something that we need to continue to do, especially as the fellowships start using the signaling for their own programs. I think first and foremost, what's important is how is this going to benefit the applicants? That because at the end of the day, that's the most important thing. How does this benefit them? If we find from the data that it is not ultimately benefiting them and potentially actually harming applicants in some way, then of course we need to know that and then change course. And it's not just about how does it benefit applicants, it's about how does it benefit all applicants. That's really the important part, right? Because applicants come from different backgrounds. They have different degrees, whether it's MD or DO. They are either coming from programs within the States or they're international medical grads. And all of that is really important in terms of whether or not this signaling is benefiting everyone. And we don't have yet a lot of data on how it might be affecting men or women applicants differently. We don't have a lot of data on how it might be affecting applicants of different ethnicities, different races. We need to gather more information. And again, to AAMC's credit, they have been working in collaboration with a group called Thalamus, and then they have some sort of offshoots of Thalamus called Cerebellum and Cortex. These are programs that are designed to gather data and then allow us to analyze this data as we move forward. And all programs, that's another thing that's really important, should make sure that they use Thalamus, Cortex, Cerebellum, which are incorporated into ARIS now for their recruitment process, so we can get data from as many programs as possible.
That's that's very good to know. I'm curious about this. Do programs need to do anything special in order to use this software? Is it automatic? Is it free? How does that work?
Yeah, great question. So it is now free. These programs, they've made it free basically for all programs. It wasn't initially, but that is a big part of how any program can use it. And again, it's a change, and again, change is hard. But we actually, our program is going to use it for the first time this year. We had the opportunity to do it last year. We didn't for various reasons, but I've reviewed it, and I've seen all the different things that it can do, and it seems like it's in a eons better than what the old system allowed for us. So I think every program will actually benefit from using these new tools, and then also it will allow for again this data acquisition.
Well, thank you for taking the time to talk, Ben. I think this has been very helpful. Are there any last comments or last words you want to say about signaling as it pertains to this application cycle?
No, I really appreciate. Thank you for the opportunity to provide this information for everyone who's involved in the recruitment process, both applicants and programs. I think it's going to be a educational year in terms of how both applicants and programs are using signaling, and how it affects both positively and potentially not positively the recruitment process. But I ultimately think, from what I hear and what I know, that this is really going to change the way we do things for the better. I think ultimately it is going to make it better for the applicants and for all applicants. And I think programs are going to see a lot of benefits to this as well. I mean, not only will they get a better idea of who truly is interested in their program, and with virtual interviews and the number of applicants increasing, that's going to be a wonderful thing to have. But also, because the number of applications are increasing, I think we're going to see actually a somewhat of a decrease in that number, which is going to help us as programs take the time to really provide that holistic approach to recruitment that we all want to do. But when we get so many applications, sometimes it becomes much more metric driven, which is not the way we want to go. So I think that there is potentially a lot of benefits that will come from this, and we will see as the years go on.
Great. Well, thank you, Ben. And as a reminder to everybody, the article is live in JACC right now online. It sort of goes into more detail to everything that Ben talked about. Whether you're an applicant or a program director, there's a lot to learn about this. So thank you again, Ben, and best of luck in the interview season.
Thank you.